we're going to demonstrate how to do a complete neurological assessment. We can do it fairly quickly, right? And during that process, we're going to go through, we're going to assess all the 12 cranial nerves. We're going to look for any kind of deficits. We're going to identify any of the potential symptoms of a stroke. And this quick process will give us the ability to do a complete head-to-toe assessment very, very quickly. All right. So the first thing we want to do is just approach the patient, introduce ourselves. Hey, my name is Mark. I'm a paramedic. I'm here to assess you. Is it okay if I can assess you?
Yes, sir.
Neuro assessment, we're going to start up at the head. All right. So what I want to first do is assess and go through. I'm going to assess the peripheral fields. I'm going to assess the eyes. I'm going to assess sensation. I'm going to assess all the way down. I'm going to assess motor movement of the shoulders, arms, extremities. I'm going to look for weakness and strength bilaterally. I'm going to check your visual fields for see if there's any deficits both peripherally and centrally. I'm going to look at your ocular movement, and I'm even going to assess your hearing. Okay, and so we'll do all that fairly quickly. The one thing that we will miss really is an olfactory assessment, and of course you could pull in something that has a unique smell for them to do, like peanut butter or something of that nature, but that's really not pertinent to the findings, at least from an EMS standpoint. Okay, so our approach is simple. We want to approach the patient, give them some simple directions, and they will start to follow those. Okay, so I'm going to assess your visual fields. I want you to look at me, and I'm going to tell me when you see my hand. Okay, so I'm going to put my finger on their chin to make sure they hold it steady, and I'm going to stand in front of them about 12 inches out to the side. Tell me when you see my hand.
Right there.
Okay, notice the distance. Swap it over. Same thing on this side.
Right there.
Okay, they're equivalent. Now I want to do the same thing. I'm going to assess your ocular movements. I want you to follow my finger, keep your head still, and only move your eyes. So I'm going to go left, allow it time to come back to center and stop, to right, center to stop, up, down, and then I want to assess to the tracking to the corners, right? He is able to track me in all quadrants, and then I want to track his accommodation directly toward the center. Okay, now I want to assess your pupilary response. Look at me, I'm going to cover this eye. Okay, it's about 3 millimeters in reactive. The same on both sides. Okay, can you tell me how many fingers I'm holding up?
2.
Okay, very good. So now I've assessed his visual fields. I want you to tell me, can you feel me touching you here?
Yes, sir.
Does it feel normal?
Normal.
Does it feel the same as I touch you on this side?
Yes, sir.
Okay. How about down here on your arm? Does that feel the same?
Yes, sir.
How about on this side?
Yes, sir.
Okay. Can you feel me touching on your thigh?
Yes, sir.
And can you feel me touching on this side?
Yes, sir.
Those all feel the same?
Yes, sir.
Very good. Okay. Now, I want you to close your eyes. Can you hear anything in your left ear?
I can.
Can you hear anything on the right ear?
I can.
Okay, it's good not to give them a clue of the left or right and to ask them to tell you where you hear anything. You can also ask them if that sounds normal. Okay, now I want to assess your motor strength. I want you to lift your shoulders up both at the same time. Very good. Okay, now next thing we're going to do is I want to assess your speech. I want you to repeat after me. Say, you can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Okay. Now I've listened to his speech. He was able to communicate and articulate that very clearly. Now I want you to smile and show me your teeth. Stick your tongue out directly at me. I've looked at facial symmetry. I looked at his tongue symmetry. Everything looks good there. Okay. Now I want you to I want you to pay attention, and then I want you to follow what I tell you to do. Okay. I'm going to show you exactly what I want you to do. I want you to close your eyes, hold your hands out by your side with your palms up, and I just want you to hold them up here until I tell you to stop. Bring them in front of me. There you go, palms up. Now just hold them there, and what I'm looking for is pronator drift, so his arms would drift down and rotate to the side if there was weakness. we ask you to close your eyes so that way there's no compensation, okay? You can put your arms down. Now I want you to put your arms down by your side. I want you to lift this leg up against me. Very good. I want you to do the same thing on this side. Very good. Okay, now we're going to assess coordination. I want you to pay attention, and then I'm going to get you to do the same thing again. Okay? I want you to close your eyes, and this time I want you to touch your finger to your nose with alternating hands, and then you can touch them together. Okay? Finger to nose, and then they can touch them together. Very good. Okay, you can open your eyes. Now I want to assess the same coordination. So now what I want you to do is I want you to take the heel of one leg, put it on your shin of your other leg, and go up and down. And I will show you. Left to right, up and down here. Then I want you to stop, and then I want you to do the same thing with the other leg, okay? Very good. Very good. Well coordinated, okay? So now that I've completed that exam, I know fairly certain that he's neurologically intact. There are a few more things that I would like to assess, like your gait and coordination. Now, I'm comfortable with the fact that you have good neurological control and that you are strong enough that you can walk. So this is a perfect time for me to assist you to walk. I would like you to stand up. I'm going to continue to hold your arm just to support you. And I just want you to take a few steps. And what I'm looking for here is just a nice normal gait. Very good. If you would just spin around and come right back, and we'll go right back and sit down again. Help them sit down, make sure he doesn't fall. And there I'm just looking for ataxia again. I'm just looking to see if that gait is steady and controlled. And finally, I can get them to sign a form, and I can look for their ability for fine motor control to write your name down, and that'll give me fine motor control. Okay? When you do that, takes less than a minute, and that is a complete head-to-toe physical assessment. I've assessed all of the cranial nerves. I've assessed visual fields. I've assessed the likelihood of him having a stroke. I've assessed for dizziness and cranial cerebral infarcts. So it's done a good, complete physical assessment.